So Dr. Sadati, tell us what it's like to be in a natural lift consultation with you.
Well, natural lift is my way of doing lower face and neck lift in a natural way. So basically, before I go to explain to patient what it involves in terms of surgery and techniques, I make sure they have the realistic expectation. So my goal is here to figure out why patients are here, to hear their story. I want to hear what is it that they see in the mirror, in a selfie, in a video, that they feel that part of their face is not matching how they perceive themselves in their head. Basically, there's a mismatch of how you perceive yourself and how you look on the outside. That there's a mismatch. People work out, they have a healthy lifestyle, but and they do great things that some 20-year-olds can't do, but their face looks like a 6-year-old. So we need to match that. So I ask about their expectation, make sure their expectations are realistic. So our philosophy is to make a person rejuvenated, refreshed version of themselves, to make them more youthful and look better but not different. That's our goal. We're not making Barbie doll or movie star here. That's to begin with. So, as we age, there are 3 main layers in the facial anatomy that get affected by aging process. The first layer is the superficial layer, the skin. As a result of aging, sun damage, hormonal changes, genetics, and stress, it changes the color, texture, and thickness, leading to fine wrinkle, aging spots, and kind of dull skin. So, there are a few treatments to deal with that. First, you start with sunscreen and skincare products. Then you do some peels and so forth with estheticians to make it refresh. Then if it doesn't respond, then we take it a notch up and we do laser resurfacing, whether it's IPL or fractionated CO2 laser. The second layer that gets affected by aging process is the subcutaneous facial volume, which is the dermal fat. Some people lose that dermal layer of volume, and they lead to sunken and hollowed area of face, and that makes them look old and more aged. Therefore, we use initially with dermal fillers such as Restylane, Radius, Voluma to replenish the volume loss. After a while, they may not be responsive and they require a lot of volume. Then we resort to using fat grafting with PRP that I have written an article in American Journal of Cosmetic Surgery. We're doing research and it's been very effective. The third layer that gets affected by aging process is called SMAS. S-M-A-S, superficial musculoaponeurosis system. Some people refer to it as a muscle. It's not muscle. Muscles are for movement. We cannot tighten the muscle that move your jaw, otherwise you can't move your jaw or move your neck. The layer above it is called SMAS. That's all plastic surgeons who do a good job on facelift, they work on that. So that layer works like a netting, covering all, first of all, it's as thick as this. It's underneath the fat. So you have skin, fat, and that SMAS works like a netting, covering all this area, and then goes become platysmal muscle and attaches to here. That's the one that holds the whole face and neck like this when you're young. As a result of aging, sun damage, hormonal changes, and genetic, you lose collagen and elastin in that tissue, and things start going south. You start getting nasolabial folds, marionette line, jowls, and the neck start moving forward, and you start seeing the edges of these bands, which is continuum of that SMAS. My goal is to reposition that SMAS to a new position that fits the person that's sitting in front of me. as if I'm a master tailor. I'm gonna tailor a wedding dress or wedding suit, if it is for men, that fit them that day, not when they were 25. It's not gonna fit your sister or brother, nor their best friend. So now for this mask, it's not all surgical treatment available. Some people are not candidates, Mari. So we use non-surgical devices such as radio frequency devices we do have, such as Vivace, Profound, that tightens this mask for people who are not quite ready. But if it's surgically required to do that, then it requires my natural lift. So how I came up with my technique is when I was training to become a facial surgeon over 20 years ago, I observed a lot of different surgeons with different skill sets, different outcome, different look, and different recovery. And I figured out how everything works. Then I created my own technique based on 4 principles that are important to me. One, that has to be natural. It has to look natural. Number 2, be able to do it under local anesthesia and twilight sedation without the need for general anesthesia. That's very important because it's excellent for people in advanced age with medical conditions, and also it's less dangerous. Number 3, no nerve damage leading to palsy, meaning you don't get your nerve cut and you have a permanent damage. And number 4, longevity. I'm going to do something for my patient that has a long-lasting effect. Takes at least 10 to 15 years off of their face, and they're going to continue to age. Nothing is permanent. So I came up with my technique. I published it in American Journal of Cosmetic Surgery, and I've been invited all over the country to give a lecture about my techniques to other plastic surgeons, and many of them, they come here and observe me during my surgery to pass on my technique to other surgeons. So before the procedure, if people taking some vitamins and blood thinners, we call them, we tell them to stop. The day of surgery, they show up here. My nurses take their blood pressure, vitals, and they give them a bunch of pills initially to relax them. Then I mark whatever I need to do on that mask. I mark them on their skin. Like when you go to a tailor, they make you stand up and they mark everything on their skin. The same thing, while they're sitting up, I mark whatever I need to do under that mask, how much I'm gonna tighten it, I mark it on their skin. Then we let them relax. After 45 minutes or so, they become more calm and relaxed. We take them to the operating room. There we're gonna give them a little IV and they go completely to sleep. Now they're asleep, but they're not intubated, meaning there's no machine breathing for you. It's like colonoscopy. It's called twilight. Now, I use this opportunity while they're comfortably asleep to inject and block all the nerves in the face and neck area. That takes me half an hour to do. But when it's numb, it's numb for over 12 hours. The procedure normally, if it's lower face and neck, takes about 2.5 hours. So not only they don't feel pain during the surgery, but also when they go home, they don't feel any discomfort. So normally my patient, 95% of my patients take Tylenol. So after everything is numb, then if they have some fatty tissue here, I make a small incision here with a very tiny little instrument called cannula. I do sculpt the neck and jowls area. If there's a band here, there are bands here, I will tighten them together. It's called placysmoplasty. If they don't need it, I won't do it. Then I need to take this mask back to the original position. So I make a small incision here in the hairline, goes inside the ear, comes out inside the crease here to hide it, and over and it stops here. Now, after I make the incision, I lift up the skin just a little bit around here to see this mask here. But remember that mask goes all the way to here. I would not lift the skin beyond here because there's a nerve here that moves your face and mouth that I've done over 3,000. Zero nerve damage because I stay in the safe zone. I never violate the tissue in this area. Now, let's assume this mask in this area and this area, which is as thick as this actually, is gonna look like this, wrinkled here and loose here. So I won't lift the tissue all the way here to fix it. I just lift the tissue around the ear to see this mask here. Then I grab this mask, lift it, hold it, and suture it. That's my technique, like a C shape. One layer, two layers, 3 times. So this is not gonna fall that easily. Remember we said longevity?
Right.
And we didn't want to have nerve damage. Now the key to my technique that people are gonna look natural and youthful without looking cool is the way I tighten this mask. That's the important part. So I will not tighten their cheek as much as I'm gonna tighten their jowls nor their neck. So at this point, I only tighten this mask 20 to 30%, 30 to 40%, 40 to 50%, 50 to 60, gradually increasing till 100% here. Next depends. Some people come with a little bit, which is 110%. Some people come with 300% if their neck is hanging down here. So that's adjustable. That's what I say is like a tailor. I can't do one thing for everybody. So after this mask is tightened in 3 layers and gradually, now I need to trim the excess skin. Now the skin and the mask were loose like this. I tighten this mask underneath. All the loose skin is going to be sitting out here. Then I go ahead and trim the excess skin around the edges. When I let go, the skin comes and sits next to the incision line with no tension. Tension causes scar. We don't want any scar. Then I put everything back together with very fine suture, as fine as their hair. I don't use the staples. I don't let my assistants nor the surgeons who come and observe to do the surgery. I do everything from A to Z. Now at the end, there is going to be a small drain on each side that sucks the dry blood out so the patient don't become bruised and swollen. Then we wrap them like a mummy, like a big old wrap, and that's for reducing pressure. We don't want reducing swelling. It applies some pressure to reduce swelling. So, and also prevent bruising. That stays for 1 night only. So they go home. Normally they take Tylenol. They're bring them here the next day. We remove the head wrap, remove the drain, and show them how to clean it. And a week later they come back and we remove and reveal the whole thing, which is removing the sutures. That day, everything looks great. So they can go to a mall and with hair down, nobody can ever say that they have surgery done. But they can see and the result immediately how well it looks. But obviously there's some numbness and swelling involved that is going to go over a period of time. But they're not like looking like a swollen like a pumpkin after a week. So it's very natural, it's excellent, my patients love it, and I love to do it too.
Wonderful. Why don't you tell us about how do you know when someone is not a candidate for a natural lift?
Age is not a criteria for being a candidate or not a candidate. I've done surgery on people who are in their mid-30s. They have some sort of skin disorder that literally the skin comes like this far out and they have loose skin and they have a little 3-year-old walking with them and a waddle in their neck. Obviously, that is important to do. And I've had some people who are in their 50s, they're so tight that I can't do any lifting per se of this mask, but they have a small little jowls here and looseness here that I recommend non-surgical treatment that we do have available at our aesthetic lounge, and those are various treatments. So as far as we have laser surfacing, we have microneedling with radio frequency, and for people who have a little bit more than jowls, we do have thread lift. That's excellent for people, even they had previous facelift, you know, like 5-6 years prior, and they're not quite ready to get a redo, but they want to look refreshed. So I recommend to do that, and that's why I created the whole aesthetic lounge in addition to gallery of cosmetic surgery, to provide my patients who needed something, but surgery was not a solution for them. So I want to be comprehensive caregiver for people who walk in my practice, to give them the best. We have the best providers, and so I'm happy to help people to keep them youthful and keep them the inside and outside match, however it is, whether it's surgical or non-surgical.
So Dr. Sadati, why don't you tell us about the longevity of your facelift and how they can make it last a little bit longer?
Facelift is, what it does, it takes the clock back. So depends on the individual health and genetics and so forth. Aging process will go on. So my goal is to take 10 to 15 years back the clock and to start aging again. So in the process, there are people who would like to maintain their resolve. They need to do certain things to maintain it, like microneedling, radio frequency, PRP injection. It's like buying a brand new car, right? So you go buy a brand new car, you can't just hope, I bought a Porsche and I'm gonna run it because it's a great car, and not changing the oil, not putting air in the tire, not washing the car, and hoping that it's gonna be the same model 10 years down the road. No, that's not gonna happen. But you see some cars that are from 20 years ago, but the individuals take care of it, take care of the oil, polish it, clean it, maintain it, and the car looks beautiful even after 20 years. That's how it works. The same thing for the face. You have to take care of it. So you do a facelift, you take the clock back, now you got something beautiful, now you need to maintain it. So that's why we have Aesthetic Lounge with great providers that can help my patients who have done facial rejuvenation to keep maintaining their face results.
Wonderful. Thank you so much, Dr. Sadati.
My pleasure, and thank you for having me.
Of course.